Online TV, power to transform lives.
Welcome back to Family Life with Mama RITA. We thank God for a brand new day, for a brand new dawn. My darling, if you wake up in the morning, remember to say thank you to the Lord. These days we are taking a lot of things for granted. We are taking His grace for granted. We are taking His love for granted. We are taking His mercies for granted. If you forgot to say thank you to the Lord today, it's not too late. Please, let's all say thank you, Jesus. I know we are still in the pandemic. Every day I'm hearing something bad, but the Lord has kept you, the Lord has kept me, and we must remember to say thank you, Jehovah. Well, those who are still expecting sex in marriage, I'm done. I'm done with sex in marriage. You loved the topic too much. I'm done. We finished last week. We are in the month of October. The month of October is Pink Month. If you don't know what Pink Month means, month of October is a month of breast cancer awareness. And we need to be aware of cancer, breast cancer. We need to be aware of what is happening around us. We need to be aware of how to prevent it, and we need to be aware of how to cure it. With me today, is a lovely daughter of mine. She was here in October last year. My darling, levels are changing. Titles are changing. Addresses are changing. Last year, she was here as a single person. This year, she is here as a married woman. With me in the studio today is my own daughter, Dr. Mrs. Betty Atefa. Hey, things are happening. Dr. Betty is a medical doctor. I saw her being born in Royal House Chapel. Started crawling in Royal House Chapel. Started wee-weeing on my laps. Went through Sunday school, went through teen service. Today, she's a medical doctor. She's a medical doctor with St. George's Hospital. St. George's Hospital and Fertility Center. She's also a CEO. Hey, Dr. Betty, you are doing everything. CEO of Salad and More, and married to Reverend Dr. Emmanuel Atefa. So, Dr. Betty is my guest today, and we are going to talk about breast cancer. My darling, if you're a husband and you're a man and you are listening to me, please don't change the station. Don't change the station. I heard for the first time last year that apparently men could also get breast cancer. And these days, men are going to Kolebu Teaching Hospital and they are removing their breast cancers. Except that the men are not like the women who would want to come and share their testimony. But next week and next 2 weeks, I will try and come with survival patients to share their story. Trust me, when you go to the hospital and they tell you there's a lump in your breast, or they tell you you have breast cancer, my darling, don't go and kill yourself before God kills you. Don't die before your time. You are not dead yet. It is not bad news. I know people who were declared as breast cancer patients, and they've been living for over 25 years. So, my darling, it is not a death sentence. It is just for you to be careful and take good care of yourself. Dr. Betty.
Yes, Mommy.
Hey, marriage is good for you. Oh. You are looking so pretty.
Thank you, Mommy.
Welcome to Family Life.
Thank you. It's an honor to be here. I'm glad to be here once again. Last year was a beautiful interaction, and I hope this year will be far better than last year's. Dr.
Betty, though we are talking about breast cancer awareness and the main topic is breast cancer, I think let's start. I know there are other breast diseases, and sometimes we overlook it. All we are looking at is breast cancer, and sometimes when we see these diseases, we get scared. We think we have cancer, yet it's not cancer. So before we go into breast cancer, let's talk about the other breast diseases we have and how we can prevent them. And then we will go on to talk about breast cancer.
Okay. Thank you again for the opportunity. It's an honor to be here, and it's an honor to be able to use this platform to reach out to almost everyone in the world, because once you are using an online platform, you have the opportunity to reach out to people in areas that you couldn't even step foot in if you had the opportunity. So the breasts are usually paired. Okay. Normally, everyone is born with a pair of breasts.
Okay.
It could be developed or not.
But do some people have more than two?
Some people are born with an abnormality that's more than two breasts.
Okay.
Okay, so in that case, there may be one, we call them axillary mammary glands or axillary breasts. So those ones can be found at different locations.
Okay.
It can be on the abdomen.
Oh, okay.
It can be around the chest.
And you call it breast?
Yes, because when they are examined, they have the same structure as breast.
Oh, okay.
So it's up to your doctor to notice this early while you are in the first few days of life, and then manage it accordingly. So sometimes some surgical procedures, minor surgical procedures are done to remove those extra breasts. So apart from that, being born with two breasts can either develop or not, based on whether you are a man or a woman, or a male or female. So ladies or young ladies tend to have development of their breasts during adolescence. So initially, adolescence was seen to be from around 15, 14 there. But now, as young as 9, 10, yes, they are developing the breast, they are starting the menstruation and all that.
I was in school with somebody as early as class 3. Her breasts were big. She was having her period. And at that time, we hadn't heard anything called period. She came to school and she said, I'm in my period. And we were so inquisitive. What's period about? What is it? You know, these days people are getting it so early.
Very early.
Wow.
Yes. And at that age, if you are not counseled well, you tend to couch into a corner because your friends are not menstruating.
That's right.
They are not having breasts, and only you have started early. So counseling for younger children starts very early at that age. Okay. So development of breast occurs in different stages. We have them called Turner staging. So initially they may be called breast buds. They are very small, and then gradually they increase in size until they get to the more matured form. And once it gets there, you just go through menstruation, on and off menstruation as your cycle proceeds. And then when you get pregnant, there are changes also until you go into menopause, and then you see some final changes in the breast and all that. So that's the journey the breasts go through as a lady. And as a man, the breasts do not develop. because you do not have higher levels of hormones called estrogen.
Okay.
Men have higher levels of testosterone than estrogen. That's what makes them men.
Okay.
And it's the upsurge of the testosterone at adolescence level that gives them the breakage of voice, the pubic hairs, and all of that.
Okay.
So ladies develop differently from men when it comes to the breast development. Now, people focus on breast cancer and tend to ignore the other diseases that affect the breast. And they can even kill faster than breast cancer.
Wow. The other breast diseases can kill faster than breast cancer. Wow.
And they are ignored most of the time, or they are mistaken to be breast cancer.
Okay.
Okay, so something like simple infection. Once you can have infection called boil in any aspect of your body, and the skin over the breast can also get infected. Now, this infection will be as painful as a boil. It will be as reddened as a boil in fair people. So you see this and you think that you have breast cancer, but it's actually a breast infection. So this breast infection can proceed to affect the other breast, or even go into the chest, and then be transferred to the other parts of the body. We call that sepsis.
Sepsis.
Sepsis. When it affects
people have terms.
The rest of the body. So something as simple as breast infection, something as simple as boil, can also affect the breast. We experience heat rashes once in a while, and the heat rashes affect the skin. So the skin on your breast can also get infected. Now, once the skin on the breast gets the heat rashes, it can look like breast cancer if you don't know what breast cancer is about. And then you might mistaken it to be a problem with your breast, but that is not so. There are some ladies that also wear very, very tight fitting bra. The bra is so tight that it's twice smaller than their normal cup size.
Please, when you want to buy a brazier, go let them measure your breast. Get the right size of bra. Don't go and get bra much smaller, 2 steps lower than your breast, because you want your breast to be smaller. You can get your right size and your breast will still look very, very, cute and nice. So please be careful. For those in Accra that go to bend down, Katamanton, please, when you go, let them measure it, and be sure that it fits you perfectly well. Don't go for something too small that might give you problems later on.
Yes.
Continue,
Mommy,
Dr.
the problem
Betty.
with that is they feel the pain. But they endure.
Wow.
Throughout the whole
So
day.
what is this on the skin?
So this is from a tight-fitting bra. That's This is a fair lady. So you can see that the place is reddened. So you can imagine the kind of pain this lady is going through, but has been enduring this pain because she wants her breast to look like it's standing or something like that. So over a long period, there's fold of the skin, and then the place gets inflamed. When it gets inflamed,
Dr. Betty, we need to let them know that some of the pictures are a bit disturbing. So please, but it's very good for you to watch and learn. Please, some of the pictures are a bit disturbing. If you are like me, that can watch certain things, just watch it small. But this is very, very educative. We need to learn and then know.
Okay, so once it gets folded over a long period, the skin begins to react by trying to envelope itself. Whilst enveloping itself, it builds on layers, and then it forms something like a mold, like you saw in the picture. This is painful. So that is also one of the diseases that affects the breast. We can also talk about people who have well-endowed breasts, those with big breasts. Sometimes they tend to forget to wipe under the breast or to even wash under the breast when they are bathing. So after a long period, they wear the bra the bra gets sweaty, the place gets wet and warm and moist. The skin there begins to change color, it gets darker. But it is, at that point, it's not painful.
Okay.
And so they still continue to ignore it.
Wow.
Until
so,
it begins to,
Wow.
That's how bad it can be.
So for not washing under your breasts and not wiping it after, wow. Yeah. So ladies, you are seeing it. You are seeing it. When the breast, under the breast starts getting darkened, it means that there's too much dirt there and you are not washing the place well. When you go to the bathroom and you have a shower or you have a bath, make sure that you lift up. For those of us who have been to the labor ward and we breastfed 4 babies, our breasts are not the same. So, you know, it's sort of covered. Remember, when you have your bath, lift it up. Wash under it. After you are done, take your towel and then wipe it dry so that you don't get darkened spots under your breast and you don't get balls and all that, you know, infections and that. Wow. Please show the picture, let people see it. It's important. Anytime you remember this picture, you'll remember to wash under your breast and you will remember to towel it dry. Oh, wow.
So it creates a fertile ground for yeast to grow. And yeast infection can get that bad.
So this is not a drama. It's not a film.
No.
It's something that actually happened in the hospital. You saw it.
Yes.
Wow.
It can get that bad.
Wow.
And we have something we call lactation mastitis.
Okay.
Lactation mastitis is what happens to breastfeeding mothers.
Okay.
Imagine breastfeeding a baby. The baby finishes feeding on one breast and falls asleep. Meanwhile, the second breast is engorged. It becomes painful. And you, as an average mother in Ghana, you may not have breast pump. So once you don't have a breast pump, the breast gets engorged. The milk stays there. It gets very painful. Wow. Most women are lucky.
Don't remind me of my days of breastfeeding. It is over with me now. Wow.
So that thing is very painful. Most women get away with it. However, there are some that are so not so lucky. The breast gets engorged, it gets painful, it gets cracked, infection sets in, and then you see some sores around it.
Wow.
So this is a picture of a mother who was breastfeeding and for some reason could not breastfeed the baby on that breast. So it got engorged, it got painful and infected. Wow. So you can see some sores all around it. So when it gets to this stage, we have to drain the breast so the woman can get some relief. After we drain it, then we add the antibiotics to. Yes, so the baby will be feeding on the other breast.
So this can be worse than breast cancer?
Yes. This can infect the whole breast and then lead to the sepsis that I spoke about.
Dr. Betty, before you continue, the picture we saw before this one with the darkened, you know, under breast and then the balls and the rashes under the breast. Apart from not washing the place and wiping it dry, can braziers also cause this? If you don't wash your brazier very often?
Yes. That's a common thing that causes it, especially with ladies who may not have a lot of bras or who do not air dry their bra. You realize that you use the same bra today, you do not air dry it. The next morning, the area with the metallic bands or plastic bands, that area may be moist. And then you wear it over the same wet breast again. You sweat during the day, so it gets worse.
Wow.
By the end of the day, you've built on what you had in it yesterday, and it gets worse over the days. And so that can also lead to that.
How many times can we wear a bra before washing it?
To be fair, I would say that at least 2 days.
At least 2 days.
At least 2 days.
Please, I hope a lady out there or a woman out there is listening. Don't wear one brazier 1 month. Don't wear one brassiere one week, especially in this part of the world where it's so sunny, we sweat so badly. When you wear your bra and you go home, Dr. Betty is saying that air it. If you have to wear it again, air it. In other words, put it in a place where, you know, air can pass through and it can dry up. It shouldn't be wet with sweat by the time you are re-wearing it. And as much as you can, every woman needs 2 brassiers, at least 2 brassiers. I know women who can buy Brazilian hair, and please tell me some of the hair you people have been wearing.
Bohemian,
all the
Indian.
kind of hairs you are wearing. People are using 2,500 to do one hair. My darling, please invest in brassiers so that every other day you can change your brassiere, so you don't get to wear what we are seeing, we saw on the screen. It's very, very important. So apart from bathing and washing the place and towel drying, make sure that at least one brassiere is worn twice. And even then, when you wear it once, air it. Air can pass through, let it dry up, and then you can wear it again the second day. Don't wear one brassiere for more than 2 or 3 days. So it means that everybody needs 2. Once you are wearing one is washed and dried so that anytime you can keep changing it. Wow.
The other thing with the bra is the protrusion of the metal out of the bra.
Hey.
Or the
those with iron rods.
Yes. So it is common to see that when you are washing your bra, it comes out. So once it comes out, you should do well to either sew it well or to totally remove the metal.
Okay.
Okay, because if you don't do that, you think that you just push it in and then it's back.
Dr. Betty, let me tell you my story.
Tell me,
I was in church. Church, I had come dressed up. I was in church. And I could feel uncomfortable in there. I could feel it. So all I did was to do this. What is happening there? When I realized the metal under the band had come out and was pricking me and choking me. And I couldn't even use my finger to push it down. So I got the toilet roll while service was going on and preaching was going on. I kept doing this. I'm sure somebody will be looking at me and wondering, what is happening to Mama Rita? Oh my God. So we just have to remove it, throw away.
Or sew it well.
Or sew it well.
Yes.
Okay.
So that it doesn't pierce into the skin.
Okay. So what happens when it pierces you?
First, there will be injury over a long period.
Okay.
And it might get infected if not treated right. Okay. Yeah, so we can avoid all that.
Okay. So continue. You're talking about breastfeeding and all that.
Yeah. So apart from that was the lactation mastitis.
Yeah.
So the other one is breast pain.
Okay.
People believe that once there's pain in the breast, it means that it could be breast cancer. But on the contrary, breast cancer doesn't usually come with pain.
Wow.
When there's pain with breast cancer, it probably means that there's some superimposing infection or there's a very aggressive forming breast cancer going on. Or there's something else causing the pain, like a sore or something else. So breast pain does not necessarily mean that it is breast cancer.
Okay.
During our menstrual cycle, at certain times of the month, it could be before your menses or during your menses. Some people experience it a short while after their menses. You have pain. At that time, the breast would have been engorged and painful. It's purely normal and controlled by the hormones because there's an upsurge of the hormones during that time. This is controlled by the brain. So once your menses are over, the brain senses it and sends signals to the breast to go back to its normal size. So at that time, it becomes less painful. If you notice this every month, meaning it's cyclical, then it is not breast cancer. There's pain also associated with the breast when you're on some medications.
Okay.
So your doctor should be able to let you know that this is the side effect.
Okay.
So you just guard yourself. When there's pain, trauma to the breast, for some reason something hits your breast, someone hits your chest, it can get painful. So those are the other causes of pain in the breast. Even the infection or the sepsis can also be painful. The next one is itchiness of the breast. Itchiness can be from rashes. It can be from dry skin. Some people have problems with their skin naturally. Because there's skin on the breast, it can also get dry and it gets itchy. That is not breast cancer. Skin rashes can also be itchy. It's not breast cancer. And some hormonal imbalances can also cause the itchiness. It is also not breast cancer.
So with everything you have spoken about, the diseases apart from breast cancer, how do you treat them? How do you cure it? With a darkened portion, with the bulbs, with the itchiness, and you know how do you cure them?
Okay, so we'll take them one after the other, so it will be easier. Skin rashes or heat rashes is the easiest. Whatever you use to treat heat rashes on your skin, use it to treat it.
The breast,
Simple. Dusting powder and all that.
Making sure. Powder. I haven't seen some in a long while.
Yes. So all that helps in treating it. Other forms of rashes which are infectious will be treated with cream and antibiotics and all that. Infections within the breast, like the boil and all that, can also be treated with medications, antibiotics, and then all that. Itchiness can also be treated. Maybe you are allergic to something and you're having itchiness all over your body, not just on the breast. Or you have exposed yourself to some form of bra lining that your skin is allergic to. So that one, some anti-allergic medications will be given to you, and then you would get some improvement. So there's treatment for all of that. And
so the one we saw,
the yeast under the skin. There's prevention and there's cure for that. Prevention is keeping it clean and dry. You can apply your powder. Yeast infection is treated with antifungal creams, antifungal powders, antifungal injectables and orals. So those will be given you as and when you see your doctor, whichever one he or she.
So when you see these things, can you just treat them at home, or you need to go to the hospital by all means?
I would say that nothing is too simple for you to choose to treat by yourself at home. There are cases that people think a condition is simple. They start treatment and then they delay the actual treatment, and it leads to something else. And we spoke about sepsis. We talked about abscesses and then extreme forms of infection. We want to avoid all that. So just have your doctor see it and tell you what to do. And that's
we will go on a short break, and then we will come back and talk about breast cancer itself. But whilst we are on a short break or a commercial break, please let your questions flow. If you have any questions concerning breast diseases and breast cancer, and any form of problem concerning the breast, please let it flow. We will go on a short break and we will come back and handle breast cancer.
The same water that denied them the fish, the same water produced the fish. Clap your hands and say to the devil, devil, you are a liar. I will not sink. Today, whatever is sinking in your life is coming to float on top of the water. Who is this person that I am?
Join the Apostle General this October as we crown 9 weeks of convention anointing services with 2 power-packed weekends. In weekend 8, the Apostle General hosts Reverend Emmanuel Agomeda on Friday 22nd October at 7 p.m. and then on Sunday 24th October at 7:30 a.m. and 10:30 a.m. In weekend 9, the Anointing of the Father will speak on Friday 29th at 7 p.m. and then on Sunday 31st October at 7:30 a.m. and 10:30 a.m. The theme is, Have You Sung? Not Yet. It is happening at the Royal House Chapel near the Obechebi Lamte Interchange. Come and receive oil to finish well.
Welcome back to Family Life with Mama RITA. If you just join us today, we are looking at diseases of the breast and breast cancer. October is the month dedicated for breast cancer awareness. My darling, normally in the month of October, it is free to go for breast screening anywhere and to do mammogram anywhere. Most often, it is free in all our hospitals and all the labs. Take advantage of it. Last week, Saturday, just this past Saturday, Royal Ladies, we did breast screening here. And to my surprise, we had 9 casualties. Please don't wait. Early detection, detection is better and is preventable. Yeah. So please take advantage. You can go into any hospital, any lab, and go for breast screening. The whole of the month of October in Royal House Chapel, when we come to church on Sundays, we have our nurses around who are doing breast screening. On Sunday, we also did breast screening. If you don't have a place to go, you can walk into the yards of Royal House Chapel on Sunday, and we would screen your breast for you. Dr. Betty, when we talk about breast cancer, what are we talking about? Most often when we hear breast cancer, I think the hearing even kills us. It's not the breast cancer itself that kills us, the hearing. Because everybody knows that, oh, once it's cancer, then you are dying. So what is breast cancer?
Hey, when we talk of breast cancer, it is a disorder or a disease that affects the breast. It affects it in such a way that the cells within the breast are able to multiply without control. Usually it's controlled by the brain during our menstrual cycle. Wow. And then after your cycle is over, it goes back to the normal. That's in the first picture and then the second picture.
So the first picture, the darkened one,
is the cell we want to focus on.
One cell?
Yes.
Is it normal or is not normal?
That is the normal cell within your normal cycle that we want to focus on. So
and then the second one?
The second one is either during ovulation or during your menses, when it gets bigger, when it gets engorged. It multiplies in size. And it is controlled by the brain. The hormones secreted by the brain. To inform it that your cycle is over, so you should go back to your normal side. So after your menses, it goes back to the first picture. However, during when you have cancer, it moves to the second picture. You realize that the difference between the second and the third is the haphazard arrangement of the cells and the large sizes of the cells. So they begin to outgrow their spaces, begin to form their own blood cells to feed itself, thereby stripping the blood supply of the normal cells. So the normal cells begin to die off. And they grow bigger. They multiply faster.
So the third one is what we call the breast cancer. The second one is not. It's normal.
It's your normal cycle.
It happens within your cycle. Then when it moves to the third one, then it can be determined that you have breast cancer. Wow. So what causes breast cancer? It's something I've been asking myself all the time.
Growing up, we all thought that there would be a cause that would learn to know and then learn to treat it or fight it.
Okay.
But as we went through medical school and even up till now, worldwide, there's no one cause.
Wow.
For breast cancer.
So it's not like malaria. It's not that you know that, oh, if you are bitten by mosquitoes.
Yeah. It's not like that. There's no one cause, but there are lots of risk factors.
Okay.
There are factors that can be attributed to that.
So what are the risk factors?
So the factors can be divided.
Okay.
Just so everybody is able to understand.
Okay.
Into modifiable or the factors that we can do something about. And then the non-modifiable ones are the ones we can't do anything about. So those ones, the non-modifiable, being a woman.
Okay.
You were born a woman. You can't do anything about your sex. Once you have more estrogen.
Okay.
As a woman, your estrogen levels are much more than the man, although you have some low amount of testosterone. So you can't do anything about it. The next one is not having a family history of breast cancer. Someone in your family has had it. Mother, auntie, sister, grandmother. It increases your risk of getting it.
Wow.
And there's a gene.
No, Dr. Betty, you said gender.
Yes.
Being born a woman.
Yes.
You know, you're at risk.
Yes.
But now we know that men also have breast cancer.
Yes.
So it's not about your sex anymore.
Yes, it's not about the sex really, but being a woman increases your risk.
Okay. Okay.
Okay, because you have a higher amount of estrogen in you, which is linked to breast cancer.
Okay. Okay.
Yes, that's why your risk is higher.
Okay.
But there are men that also have it.
Okay.
Okay. So worldwide, we don't have a particular statistic, but in the U.S. alone, yearly it's about 300,000 cases.
Wow.
In the U.S. alone, and I think last year in Kolebu it was about 2,000
just breast cancer.
For just breast cancer, and out of the 300,000, 2,000 of them were from men.
Wow.
Yes. And then men
so now
in
when
Ghana to get it.
We talk about breast cancer. It's not a woman's thing anymore.
No. It has
so you
never
can't
been,
shut your TV. You can't close Powerline TV or change it to another station because you're a man watching it. Now it can happen to anybody.
Yes.
So do we have cases in Ghana where men got breast cancer?
Yes.
Wow.
There are quite a number of cases. And we know that generally, when you enter into a hospital, you have more women in the queue.
Okay.
And then you can count the men, one in it. So they don't show up early already. So the men too might think that it's just something on their chest.
Wow.
That's the unfortunate aspect. And they go for other forms of treatment. So by the time they realize it is breast cancer, they would have passed through so many hands before finally knowing that it's breast cancer. But so far, there have been a few men who have gone through chemo and then have joined in the public education.
Wow.
Okay, so men get it.
So, my darling, if you're a man out there and you are watching us, when you get any pain in your chest, please don't ignore it. Don't think that this is nothing. Don't think that it might be a heart pain or just a chest pain or something. Go to the hospital, look for a doctor, let them check. As for me, even when it's a mosquito bite, I'll call a doctor. Let the doctor tell me this one is nothing, then I'll relax. So please, it has been discovered that for men, they go for treatment way too late. And so please don't wait. Any form of pain in the chest area or in the breast area, go to the hospital and then let them check for you. So, Dr. Betty, you were talking about the risk factors.
Yes, still on the non-modifiable ones. There's a family gene called BRCA1, BRCA2.
Hey ho! This one isn't it a demon? Something that we don't know where it's coming from. Now that there's BRCA1, BRCA2, tell me about BRCA1, BRCA2. I refuse you in the name of Jesus. BRCA1, BRCA2.
I mean, so these genes run in families.
Wow.
Just like the way DNA is tested to know whether someone is your father or not.
Okay.
It's also tested for, but it's too expensive to do that in Ghana.
Okay.
But in the outside world, they're able to test it in families. And once a lady has been found to have the traits, she is advised to get pregnant early, give birth fast, and then the breasts are removed.
Wow.
And then silicone is put in, implants are given, and then just to avoid breast cancer.
So in Ghana now, do we do breast transplants? Is that what you call it?
The implants.
The implants.
Yes.
Is it done in Ghana?
It's available.
It's available. Are there side effects?
Not really.
Okay.
The material or the silicone that is used is one that has been tested.
Okay.
So that in a large population, you don't have it causing allergies in people.
Okay.
So that is what is used. It's the safest.
Okay.
That is used because the person has already been exposed to breast cancer and all. So you want to use the best possible implants.
Okay.
Yes.
So with somebody that doesn't have a history of breast cancer in their family, she's not prone to breast cancer, she doesn't have breast cancer, can I just get up as a woman and say I want breast what?
Implants.
Augmentation. Can I do it?
Yes, you can.
For those who have finished breastfeeding.
Yes.
And our breasts is, we go into the bathroom, we look at ourselves in the mirror and we tell ourselves, this is not my breast. This is not me. We can just walk into the hospital and have it done.
Yes.
Wow.
There are plastic surgeons available in Ghana.
Wow.
I can do that for you.
Wow.
And now young ladies even do that. Even before they start giving birth, before they even start getting pregnant.
Why do young ladies do that?
They want to portray.
Young ladies?
Yes, and they're all over social media now.
But young lady, your breast should be standing already.
Some, unfortunately, may not have that.
Oh, okay.
So in order to get to that size or to look prim in that
you
sense,
mean there are people
purposes.
who don't have standing breasts?
Yes.
Naturally?
Naturally.
Oh, I didn't know that.
Naturally. Some people come from a family with big breasts.
Oh, okay.
So at a young age, they still have sagging breasts.
Okay.
And all that. So they go in for this. I think it should be done when you are done having all your babies.
When you are done having all your babies, like me. So I can do it. I can give myself a 60th birthday present.
Hey, wow.
Oh my God. I hope my husband is listening to me. This will happen. Especially when we just finished talking about sex in marriage. Something will happen.
Something will happen.
Oh, wow. So it's done in Ghana now.
Yes, it's
I hope
done.
it's not too expensive, or it is.
It comes with some form of expense.
Some form of expense.
Yes. But if it's after treatment or after a disease, it can also be modified. The price can be modified. Yeah.
Okay. So what are some of the signs and symptoms? I hope you've finished talking about the risks.
The non-modifiable ones. So I'll quickly run through the modifiable or the ones we can do something about. For instance, not having babies early. Or choosing not to get pregnant.
Oh, not having babies early.
Or choosing not to get pregnant. Or for some reason you are not able to get pregnant. You are exposed to more menstrual cycles.
Oh.
So the breast gets bigger, it goes back, it gets bigger, it goes back at every cycle. Hormones shoot up, estrogen shoots up, it comes down, it shoots up, it comes down. You are more likely to have a higher risk for breast cancer.
Wow.
Yes. And then those who choose not to breastfeed their babies because they want to preserve the caliber of their breasts.
So breastfeeding is good?
Breastfeeding is very good. It protects you,
the mother. Wow. So it was good I breastfed all my 4 babies.
Yes.
I haven't regretted, but when I see my breast, I said, this is not my breast. Oh, wow.
Yeah, so some oral contraceptives are also linked to breast cancer.
Okay.
Especially the ones that have estrogen in it.
Okay.
We normally call them family planning methods.
Okay.
So there are injectables, implants, IUDs, and pills.
Okay.
So there are various forms. Progesterone only, mixtures, the IUDs come with copper wires and all. So it will be good you choose the one that does not have estrogen.
Okay.
That's safer.
Okay.
So that's also an option. And then obesity and high fatty diets and inactivity all lead to weight gain. Yes.
Thank God I'm not fat anymore. Wow.
They all lead to weight gain.
Okay.
Now, the body has this way of converting extra fat into hormones.
Okay.
Like the estrogen.
Okay.
So, we are trying to stay away from the estrogen. So, as much as possible, as you are losing weight, you are protecting yourself also. Smoking has been linked to all forms of cancers. Lung cancer, skin cancer, breast cancer, all forms of cancers.
Okay.
And there's the trend about shisha we spoke about. We keep talking about it, but it looks like the trend is increasing.
The one for the young ladies and the
smoking, the shisha, the scented.
So this is shisha?
This is shisha.
For the old school people who do not know shisha, please, this is it.
It comes in flavors.
It comes in flavors.
Yes, strawberry, vanilla.
Hey, somebody has been mentioning it. It means that the person has... wow.
Yes, so it all...
So there's shisha in Ghana now?
Yes, in a lot of restaurants. Classic restaurants, you will see that. And it's outdoor. They do it in the open.
And they don't consider it as smoking?
No.
Wow.
They feel it makes them look classy.
Classy. Oh, I see.
SHS.
Classy with cancer. You said what? SHS?
Even SHS students are smoking it. University students are smoking it.
And their parents know that?
Their parents might not know because they would come smelling good. You will never smell cigarette on them. So until you see them doing it or someone tells you, you would never know.
Because it comes in all forms of flavors.
Yeah.
So they smell good and you think that it's perfume.
Yeah.
Hey, parents, please, let's shine our eyes. So, I see on the screen, shisha, the new killer, is giving breast cancer and is giving all forms of cancer. So don't we have to stop it in public places? Because if I'm not on shisha, and I go to the public place, like a restaurant, to buy food, and somebody, I mean, it's out there, and they smoke it out there, and I become a second, how do you call it?
Secondary smoker.
Secondary smoker.
Yeah,
I'm also at
higher risk.
I'm
at a higher risk than even the one smoking. Because the one smoking will blow it out.
Okay.
So just a little stays in. But as he has blown it out, everything is in the atmosphere for you to inhale. So you are exposed to everything else. So the secondary smoker can get lung cancer even earlier than the smoker himself.
Wow.
Yeah.
I hope our authorities are listening to us, the restaurants, the beer bars and the drinking spots, and wherever food is sold. I think that just like now, in certain places, you can't just smoke because of the secondary smoker. Please, I think we need to do something about it for the sake of our children. If my children are not on shisha and they go to a restaurant to buy food and they are inhaling this thing, I mean, we are at risk of getting any form of cancer.
Yeah. And Mommy, over the past years, we've known about skin bleaching. We've known about the creams, the lotions, the soaps. But now there are the injectables.
For what?
For skin bleaching.
Oh, some of us are old school now.
So that the whole body
they are injecting their skins.
Yes.
So you see a nice lady out there
with uniform skin. Even the knuckles are of the same color. And it's because they've gone for injectables.
So that?
All for beauty. They do
are you not beautiful with your dark skin?
Yes, Mommy. Unfortunately.
What are our ladies looking for? And what are our men looking for? It is because the men are looking for fair-colored, half caste has been considered and has been considered as beauty. So then even dark-skinned people are going to take injections to make them fair.
Yes. And it's been linked to breast cancer.
It's been linked to breast cancer.
Yes. All forms of cancer, really. Yes. So it's all part of it, the risk factors.
We need to be very careful. I think we ourselves are killing ourselves. We are killing ourselves slowly. And the Bible says that it is only a fool that dies before his time. Please don't kill yourself before God takes your life away. Live your fullest life. There are things you must do for the world, things you must do for humanity. I mean, why would you go for injections just to be fair?
It's amazing.
And do they know that out of shisha, out of bleaching, out of going for injections to be fair, they will get cancers out of it?
Mommy, sometimes they do know because they are told. But then they want to enjoy the present, ignoring the future side effects and, you know.
So these are some of the risks.
Yes, these are the risk factors we have now.
Honestly, I'm shocked. So it's not just using cream and soaps anymore.
They even advertise it on social media. I saw one on Instagram some few days ago. Yes.
Then me, I'm old.
They do advertise it. Yeah.
Wow. For people to come for injection.
Yes.
To be fair.
To be fair.
So that they'll look more beautiful. And then what happens to the beauty?
Well, they have their own reasons.
Oh my God. I won't go and buy sickness. My darling, don't go and buy death. Don't go and buy cancer. Don't. And at the end of the day, what hurts me is that it's the pastors who suffer. I mean, somebody came to me, a young lady came to me with her mom. And this lady had gone, what word should I use? Should I use depression? Or she had gone, you know, mentally sick a bit. Okay. So the mom brought her to me for prayer and for deliverance. And I asked, is there anybody in the family who has any history of, you know, depression and all that? Her mom said no, and she's the first case they've ever had in the family. And anytime she's going to write exams, then the sickness comes. So then certainly it is demonic. And if it's demonic, where do you go to? It is church. Only to realize that the girl actually went, I don't know the latest term for it, went for Sikedro. How do you call Sikedro in your age now?
Is it Sakawa?
Sakawa.
Wow.
Was going for Sakawa money.
As a student?
As a student, a university student, second year student, was going to do Sakawa to get money. So apparently was, you know, they would always ask you to come with somebody for exchange. Come with somebody or something. There's always an exchange. Yes. So went with a school friend, asked the school friend to go and help, you know. And what the person didn't know was that the person's mother is a praying woman.
Wow.
Who is praying.
So there's a covering.
There's a covering, there's a protection. So when they went, the thing didn't work. And it backfired on the lady.
Oh my goodness.
And her mother doesn't even know the side of the story.
Wow.
All her mother knows is that my daughter is depressed. Anytime she goes into the examination room, you know, can't.
I'm sure by now her mother is working hard to pay his fees.
Yes.
And all that.
And the painful aspect is that the mother is a single woman, working how many jobs just to help her. And all your mother is looking for is for you to be done with school, do something out of your life, settle down, and be a pride and an honor to her. My darling, don't go for cheap money. Don't go for Sakawa Don't go for injections. Don't go for, I don't know what you people want in your present age. And you are going for diseases and you are going for death. Anyway, this is by the way. Let's continue with our breast cancer.
Done with the,
so
the
are we done with the
risk factors?
What we'll do is we'll take a bit of break, and then we'll come back and talk about. Have we spoken about the causes of the?
Yes,
we've spoken about causes. Maybe we'll talk about symptoms of breast cancer.
All right.
To catch God's attention. In a crowd of hundreds, blind Bartimaeus was singularly successful in catching the attention of Jesus. Similarly, there are many today seeking, just like blind Bartimaeus, to encounter Jesus but would fail. This book, How to Catch God's Attention, will unravel the mystery of the 5 key principles of prayer, covenant, faith, worship, and sacrifice that Bartimaeus apply for success. Rush for your copies now, and your life will never be the same. Order online on iBookstore, Amazon, Kindle, Barnes & Noble, or visit any major bookstore near you.
And we're standing here.
Welcome back to Family Life with Mama Rita. Today we are handling diseases of the breast, and we are also handling breast cancer. And then in between we looked at the risk factor, and I'm shocked. I don't even know what to say. So one of the risk factors are shisha. Shisha. People are smoking. I don't know what form of smoking it is. Decent smoking, or high-class smoking, or high-tech smoking, or 21st century smoking. I don't know what to call it. And people are getting cancer out of shisha. And it's not just shisha, but bleaching. Some time ago, people were using creams and soaps to bleach themselves. Now I hear people are going for injections, and the sad aspect is that the people who are going for injections are not the people who are ready to die, the 60s and the 70s and the 80s, but they are our futures. Is my English correct? Our future. Those who are supposed to take over from us, those who are supposed to rule after us, those who are supposed to take over the nations, the world movers, the future billionaires. They are killing themselves. I hear 20s, 21s, 22s, 23s are going for injections. And is it, can you reverse it?
Because it has to be maintained. They keep having sessions. So they go for it maybe every couple of months. They have to go to make sure that it stays that way.
So they pay?
Yes, and it's like a drip that will be set up on them.
To be fair?
Yes. So they go for sessions just to keep the complexion going.
So some of the fair ones we see around that we think they are half caste, and we think they are actually not born like that.
Yes.
And where are their mothers? Do they have mothers?
That's a good question.
You enter into my house with this, right from the gate. I start screaming before you enter inside. Oh, mothers, please, let's shine our eyes. Mothers, let's set up, because these are our futures. These are our prides. Let's not kill our children before their time. Yeah. They are the ones that must bury us. Yeah. Let us not bury them whilst we are alive.
Yeah.
Hey, there, I see something on the screen.
says the injectables.
It's true.
Very true. A dark friend of mine in university days is now fairer than some people I know.
Wow.
It exists.
Nanama Addison, God bless you. So it's actually true.
It's very true.
It's trending.
Overnight.
Overnight.
Overnight fairness.
Oh, so you go today, it's not like the cream and the soap.
No, they take time.
They take time.
Yeah.
This one, no wasting of time.
Wasting of
you
time.
go and then you come out. Dr. Betty, you are beautiful.
Thank you, Mommy.
I love your color.
Thank you, Mommy.
In spite of your color, you got a good, handsome, well-trained, born-again gentleman to marry you. A doctor, a medical doctor, and also a pastor, born again, to marry you. My darling, the men are not seeing you. Trust me. The well-trained men of today will not go for people. Somebody said what? It's worse here in America. US, and so bad, so sad. Very, very sad. Faith Owuswa Champon, God bless you. It's so sad, my darling. What is the world turning to? So we have things worse than HIV. We have things worse than COVID. We have things worse than cancer.
Yeah.
What are we looking for, young ladies? What are you looking for? Somebody says, God bless you, mommy, for such a wonderful topic. I am learning. I hope, Winifred, you are not going for injectable. Just to be fair, my darling, trust me, the well-behaved young men will not go for people like you unless they meet you and they don't know you have gone for injections. To be fair, I mean, they won't go for you. The correct ones will not go for you. Those who are going for you are those who are not correct. Hey, somebody said also some people have had infections from not washing bras before wearing them. They should always wash the bras before wearing it. Yeah. Thank you, Anita. Please tell your young ladies.
Yeah.
They should stop wearing one bra for 1 month. Please stop investing your money into hairs.
Mommy, this is
and
usually,
data.
Yeah, this is usually seen with people who use or who wear second-hand bras.
Second-hand bra.
Yes, without washing it.
Oh, okay.
So they buy it, they don't wash it,
oh,
and then
my God. My
it.
darling, second-hand bra. When you buy second-hand bra, me, I've worn second-hand bra before. I've gone past those days. I used to wear second-hand bra. I used to go to Catamanto and Tema Station early Wednesday morning. I don't know if it's still there. Early Wednesday morning and early Saturday morning, it's still there. Hey. Also, you are buying some. So, but what I used to do is that when I buy them, I soak them in Dettol. I soak them in Dettol overnight and then wash them. So please, when you buy second-hand braziers, don't just wear them. Wash them. Maybe the person wore it for 3 months and never washed it, and you are also wearing it. It's not just the bra, but I discovered now that even when you buy panties, not second-hand panties, new panties, when you bring the panties home, wash them before. I didn't used to know that. Then somebody told me that when you go into the shop, you know, people try the panties.
Yes.
And you are advised to try the panties on your panties. Yeah. But some people don't try them on their panties. Wow. They remove their panties and wear the panties and then try the panties. So by the time you take the panty home, the panty would have been infected. Number two, remember that when you go to the shop to buy the panties, so many people would have touched it. Yes. So many fingers. People have touched surfaces. People would have put their fingers in their nose. Making you wash your new panties before you wear them. So, you know, make sure that you wash your panties before you wear them, even when you buy them very, very new.
Yes, and swimming costumes.
And swimming costume.
Yes. You know, they come with bra and panties.
Oh.
Some of them are also second-hand.
Okay.
So they also have to be washed and cleaned.
Oh, okay. Okay. And then for those who swim, my darling, when you finish swimming, wash or rinse the swimming costume, the bra. What happens is that chlorine goes into it. And chlorine is poisonous for our skin. That is why you are advised that right after swimming, wash down, at least go under the shower and let water flow on your skin to wash the chlorine off your skin. So is with the swimming costumes. After you have swum, please wash them before you wear them again. Yeah. Hey, so Dr. Betty, we are going off, but I think people are learning out of these things. And before we go to questions, please let the questions flow. Before we go to the questions, we want to talk about signs and symptoms of breast cancer. Okay. Signs and symptoms. What will I see to know that, I have breast cancer?
All right. We'll divide these into the signs and symptoms with the nipple and then the ones with the breast itself. So starting with the nipple, for someone who has naturally had pointed nipples, if you suddenly see a flat nipple or an inverted nipple, meaning it has retracted inwards, it's a cause for concern. You need to see a doctor and get yourself examined. Okay. If you see anything dripping from your nipples, it may be milky when you are not breastfeeding. Transparent in color, it may be bloody, it may be dark in color, it may even be green. Okay. Any of these? Green? Yes. Wow. When there's some form of infection going on. Okay. So any of these, if you do see, you need to talk to your doctor, get yourself examined to know exactly what is causing it. It may even be just a hormonal imbalance. So labs will prove this, and then you get to know whether it is breast cancer or not. Now, with the breast itself, if everyone has one breast slightly bigger than the other. Okay. Okay, but if you notice that one has grown disproportionately much bigger than the other, it's a cause for concern. Okay. The obvious one is if you found a lump in your breast. Okay. You need to talk to your doctor. It's not all lumps that are breast cancer. Okay. Some lumps are benign, meaning they are not cancerous. Okay. Something like fibroadenoma. That one feels like a nutmeg and it moves around in the breast. If you feel a lump, you need to see a doctor. If you feel that the texture of the skin has changed, it's become hard, it feels like orange peel appearance, and then you see the dots on it, you need to see a doctor. Oh, orange peel? Yes, the way the dots are, it suddenly appears on the breast. Like the one we saw in the previous pictures. Yes, so when you see that, you need to see a doctor about it. And if you see any sores or darkened areas on the breast too, you need to see a doctor about it. So these are the signs and symptoms of breast. You were talking about lumps. Yes. I know this self-examination. Self-breast exam. Self-breast examination. Yes. So do you have to do it every day or once a day or once a month? All right. Or how do you do it? If you are a lady menstruating, meaning you are not yet up to menopause, you choose a day. That is 1 week after your menses has ended for the month. So you choose a particular day within that week to examine your breast. But if you are within your menopause, you pick a particular day every month to examine your breast. The reason why we choose every month is so that you would get to know your breast better. And then you can easily detect something wrong. That's with the self-breast examination. So after you've examined and you've noticed anything, you see your doctor. Your doctor will cross-check. If there's truly something to be worried about, if you're younger than 40 years old, breast ultrasound will be ordered. So that it's just like the scan you do when you are pregnant. Would see if there's anything. If you are young. If you are younger than 40, you do the breast scan. Because the breast is denser during that time. So the scan will work more. But for mammogram, it's for those who are older than 40. By then, the density of the breast would have reduced. So the mammogram rays can easily pick anything going on in the breast. So if your risk factors are not high, meaning you don't have a family history, once a year is fine for mammogram. For the mammogram, or once in 2 years. But I would prefer once a year.
Okay.
Okay, just so that you don't pick something that is 2 years old.
Okay.
Rather than 1 year old.
Okay.
But same for the scan. Once a year is fine. But if you have a higher risk factor, you need to do it as often as possible. Your doctor can give you a schedule based on your risks that he has found out.
Okay.
Yes.
Okay. The mammogram, doesn't it have side effects? Because we know the mammogram uses radiation, unless it doesn't use radiation. And we know radiation has, you know, side effects. So as you do mammogram once a year, are you rather not exposing yourself to risks, you know, of breast cancer?
Mommy, when we talk about radiation, they come in various frequencies.
Okay.
Some are safe.
Okay.
And then others are not.
Okay.
So those who work in some factories have higher frequency radiations that are dangerous to their health. So you hear on the radio that they have sued their company because they've worked within a number of years and then they've developed that disease.
Oh, okay.
Those are different forms of radiation. But once it's linked to examination of the breast, the frequency is within a safe level.
Okay. Okay.
So it's not dangerous.
I always remember this. You know, when you travel, especially in America, UK doesn't have it. Where you go into that scan and they check if there's anything on your body. I was so worried about it. So one day I challenged them and I said, listen, I don't want any radiation, you know, going through this scanner every time, you know. And the person said, what are you talking about? The radiation from your phone. So my darling.
It's much higher.
It's much higher. So those of us who are on our phones 24/7, the radiation here is more than the one through the mammogram. My darling, we are in the month of October. What's today's month? Today's date?
The 20th.
Today is the 20th. If you haven't gone to do a breast scan or mammogram or a breast check, please take advantage this month of October. Most hospitals are free or at least it's half price. Check yourself into any hospital and say you want to have a breast check or you want to have a mammogram or if you are 40 years and below, you want to have
the ultrasound.
The ultrasound, please. It's very, very important. Prevention is better than cure. So how do we prevent and how do we treat breast cancer? And then now we go to our co-host and we take the questions that have come.
All right. From the modifiable risk factors that we mentioned, we can get ways of preventing it.
Okay.
So breastfeeding your baby, if you can, get pregnant. Try not to push off pregnancy as far as you would want to.
Okay,
for
so
other
those
reasons.
who do not want to have children,
yes,
having children actually is good for us.
Yes, breastfeed your baby.
Breastfeed your baby.
Don't try
so
to preserve.
The people who want Bobby stand, you want your breast standing forever, my darling. Breastfeed your babies.
Yes.
If you breastfeed your babies, you don't stand a risk of having breast cancer.
When going for a family planning method,
let
the midwife or the person in charge explain everything to you. They are supposed to tell you the risks associated with each and every...
In Ghana, would they tell you when you ask these questions? It's always my problem and my issue.
It's true.
Somebody goes to the hospital, doesn't understand something, asks the doctor, so this or this, or the pharmacist, you are giving medication. I want to be sure what I'm taking. You ask, but I don't blame them. There are hundreds and 200s of people there, and they think that, but sometimes it's not like because there are too many people there. They think that, what's wrong? You bluff, you know, but we need to know certain things.
Yes. You need to know what type you are going for, which one you are okay with, and which one you'll be comfortable with. So try to stay away from the ones that have estrogen in it.
Okay.
If you would prefer an IUD, all the better.
Okay.
An injectable without estrogen, all the better.
Okay.
You know, there are progesterone only ones. So
Okay.
you can pick those ones too.
Okay.
Try to stay fit.
Okay.
Weight loss goes a long way
Okay.
to prevent breast cancer
Okay.
also. Apart from preventing
So
the hypertension.
they should walk.
Take
They should
brisk
exercise.
walks, yeah.
They should gym.
Yes.
My darling, walking is free. If you have a car, sometimes park your car and walk. It's a mile journey and we move our car. These days we are spoiled. Walk. For the born agains and the church going type, what you do is when you go to church and there's the opportunity to dance. Don't be shy. Please. And then do a lot of prayer walks. What I do is I do a lot of prayer walks. Whilst I'm walking, I am praying. So I am doing both spiritual and physical. By the time the day ends, I would have walked over 10,000 steps.
Wow.
And I try as much as I can to do 10,000 steps if I don't go to the gym, if I don't gym. So please, gymming is important. If you are too busy to gym, walk. For those of you who live in story buildings or your office is a story building, instead of going through the lift all the time, at least try 2-3 times a week, go through the stairs instead of using the elevator.
Yeah.
If you live on the 5th floor, walk 2 floors and then continue the rest on elevator. I think if we are doing this,
it would help. Some give the excuse that they have to wake up at dawn, so to avoid traffic, to get to work early. So if you have that kind of schedule, you can do evening walks instead of morning exercises. So that also helps. Staying away from alcohol, smoking, all that.
Please tell them
all that.
They should stay away from smoking, alcohol, shisha,
the bleaching creams,
the injectables, and you'll be safe.
Yeah. So those are the preventable measures. And of course, frequent screening also helps to detect it early and then treat it. And basically that's it.
So we will go to our co-host, take a few questions. I didn't know we were going to spend so much time. I wanted us to do 1.5 hours today. I have so many clients waiting for me for counseling. Oh my God.
It's been a very educative session.
No, very, very educative. Very, very educative. I've learned a lot. And then before we go to the questions, so now, when is detected that you have breast cancer, what is supposed to be done? And with the lumps, we know is removed. With breast cancer, what happens?
Okay, so if there's a lump associated with the breast cancer, after your scan or mammogram, other labs will be done to ascertain the spread. So a sample of the lump will be taken. So it comes with something that looks like a gun. It will be injected, so you don't feel pain. So the doctor will go straight into the lump and take a piece. And it will be given to you to take to either Ghana Standard Board or something. There are different kinds of breast cancer. It may not even be breast cancer. So it's the report from that end that would determine what kind of breast cancer it is. Some are very aggressive, others are not. Some respond to hormonal therapy, others do not. So it will come with all this information. So we would know the edges too, whether it has invaded into other edges. Some of them, the edges cannot be defined. So it is safer to remove the breast. Some of them, it has spread. So you would be started on chemo. And the chemo, in a sense, shrinks it and brings it all together to one place. So that the doctor will be sure that when I remove this edge, I have taken everything out. And then after that, some chemo sessions will also be given. So that if during the surgery there was any contamination or any little spread, the post-surgical chemotherapy would take care of the rest. Sometimes radiation will also be given after. Yeah.
To our co-hosts,
Yes. Thank you, Elma.
My best host.
For giving me this pinky look to celebrate the Pink October. I think I'll start off with a question that I think Pastor Albert Nitete of Voices in Worship would want to ask.
Okay.
So we spoke about breastfeeding children giving an advantage to women. How about breastfeeding husbands?
Hey!
I'm asking for Pastor Albert.
That's true. Because if men are also getting breast cancer. Oh,
No,
you
I
mean
mean the
men breastfeeding.
Because maximum 1 year, you are done with Express. The man can continue for 5 years, 10 years, 15, 20.
Mommy, this one is, I think it's your question. No?
It's my question. Please, we are not handling men breastfeeding here. We are talking about babies breastfeeding. Please, men, recently I saw something on social media. I've forgotten which country it was. I think one of these African countries, that their husbands are not allowing the babies to breastfeed.
Wow.
And they said it's been discovered that men who breastfeed either live long or they become very powerful in bed. And so now the new, one of the African countries, they don't allow the children, the babies, to breastfeed.
So who drinks the milk?
They drink the milk.
Wow.
Believing that the milk will make them stronger, will make them more powerful in bed. They'll stay longer. They won't die before their time, and they will never become impotent. Men, please, let the babies breastfeed. After the babies have finished breastfeeding, either a year and a half, or 2 years, you can take over the breast.
No.
So,
Pastor Eddie.
Pastor Eddie,
Pastor
Albert,
Pastor Papa.
Voices and Worship, please.
Yeah. Moral choir
guys.
Chief.
Please allow your babies to be as strong as you are, to be as intelligent as you are,
MOG.
to be as normal as you are. Pastor Pa, MOG, please stop fighting over the breasts and the breast milk with your babies. Ideal Milk hasn't sponsored me, but go for Ideal Milk or the other one, Pig Milk or Carnation Milk. Please go for it and leave the breast for your babies until such a time that they grow. When they start walking, you can kick them off the breast and you can take over.
Pastor Danajate, thank you for listening to Mommy. Your baby is too young. All right, we'll go straight to Nigeria. This is coming from Kezi in Nachukwu. Says, Mama Rita, good evening.
Good evening.
We love your program and your lessons.
Thank you.
Very educative. My question, Mommy, can tattoos cause cancer of any kind? Body tattoos.
Wow. Pastor Betty. Hey,
Wow.
Charlie, I promoted you. Pastor Dr. Betty.
Amen. Amen.
Dr. Betty, can tattoos cause cancer?
Mommy, the process of tattooing is painful.
Wow.
Some would have to take medications to withstand the pain. Now,
So tattoo is painful.
it's very painful.
So
it's
the
like
people,
they're digging holes within your skin. So they are needles.
maybe they don't feel the pain.
They do.
Wow. And they don't care.
Well, for beauty
Okay.
and for their own reasons.
Okay.
So now, it's as if they are injecting you and then putting in the ink too at the same time.
Okay.
So you heal with a scar.
Okay.
And that scar is the picture or the tattoo that
Okay.
you want.
Okay.
Now, it has been linked to skin cancer.
Wow.
Over so many years, there has been a lot of statistics about it, but people keep doing it.
Wow.
Some get away with it, and then others don't. So it's been linked to cancer, all forms of cancer.
Wow.
Once there's skin cancer, it can spread to any part of the body, and then, yeah.
My darling, I hear some get away with it.
Yeah.
Please don't follow friends to do things. Don't follow friends to smoke shisha. Don't follow friends to inject to become fair. Don't follow friends to do tattoos. Maybe they can get away with it, but maybe you don't or you won't. So please have a mind of your own and do what is right, and something that will make you live 80 years and above. It's possible. Recently, I've been reading the Bible and looking at the ages of our forefathers. And you realize that, and this person died at 150, this person died at 130, this person died at 120. Recently, I was seeing another video of women, about 10 women who are 100 plus.
Wow.
And they are telling their stories, how they've lived to be 100 years. So I realized that it is possible in our days, my darling. I used to say I wanted to die 80 years and above. But now I'm angry. I'm going 100.
Amen.
I'm going 100.
Amen.
So if I want to go 100, then I need to take very good care of myself and my body.
Yeah.
Amen.
So please, you heard it. It's possible that tattoo could give cancer, skin cancer.
Yes.
Some people could go away with it, but others don't. So please be careful.
All right, just before we go to our next question, there are two comments here.
Okay.
This one says, please, can I get a doctor's number? And then the second one says, I have felt some lumps in breast.
Okay.
I would want to visit your doctor in her hospital.
Okay.
I think at the tail end of the program, she would give you all those details that you may need in contacting her. This one is quite interesting. It says, please, mommy, can your doctor help address whether Jadel implants can cause breast cancer? These are one of the known effective family planning injectables in the skin. Can they cause cancer of any kind?
Okay. Family planning.
Jadel is an implant, and then the other one is Implanon. Okay, those two have been accepted in Ghana because they are relatively safe.
Okay.
Okay, they may come with some menstrual irregularities because they may have some hormones in it. But it's not been proven that it causes breast cancer.
Okay.
To a better extent, it's rather protects you, so you can plan your family life well. And because it's just implanted under the skin, no one really sees it. And it can be there for a while when you are ready to have...
It's implanted under the skin?
Yeah, just under the skin.
On your arm?
Yes.
And it's not painful?
It's not painful, mommy. That place will be injected.
Wow.
So you don't feel the pain.
And you wear it for how long?
It comes with years, so 3 to 5 years. But you can remove it anytime you are ready to have a baby.
I'm happy these things. I'm over with these things. I'm so happy. I'm so happy. I can have sex and not think. And be free. And not think about me having another baby. Oh my God.
So they can have the menstrual irregularities, but not necessarily breast cancer.
Wow.
And that's normal.
Wow. I think we can take...
Yeah, we can just take some complimentary messages and a question. This one says, good evening, Mama Rita.
Good evening.
I am listening from Nigeria.
Somebody says, thank you, Mommy, for this educative platform.
Great.
Bless Jesus. Hey.
That's my big sister.
Oh, that's your big sister.
Nice.
Oh, wow. And someone says, well done, Mommy. This series is very educative. I'm really learning a lot. Thank you. Augustina, God bless you. Nixon Upon says, God bless you, Mommy, for such a wonderful topic. Hey, this is your son, Nixon. Nixon, today I'm driving myself because you are watching from Dubai. May Dubai be good for you. May your business in Dubai be successful.
Amen.
I pray that you have the protection of the Lord. Please come quickly and drive me. I miss you so badly. From Bridget, I'm wondering how life would have been without family life. Kudos, Mommy. Thank you so much, Bridget. From Kwabena Akins. Hey, question 4, please.
This question for the doctor
says
he understands fat tissue is more susceptible to cancer as men. Does building muscle help, especially building chest muscles? Thank you, doctor.
Okay, breast cancer can occur at any part of the breast. when you peel the skin off, what you have below is fat.
Okay.
When you peel the fat off, what you have below, you have ducts and lobes.
Okay.
The lobes are like the grapefruits, and the ducts are the branches of the grapefruits.
Okay.
So they are all in there.
Okay.
The cancer can arise from the lobes,
okay,
the ducts,
okay,
the fat tissues.
Okay.
Okay, so once they are there, it can happen.
So that's it.
But yes. So this is the picture showing the all together.
Okay.
Yeah. So the yellow is the fats, the pinkish ones.
Okay.
And, yeah.
Okay.
So building muscles does not necessarily prevent you from getting breast cancer.
Okay.
That's if you have a higher risk.
Okay.
The only thing you can do is to make sure that you go according to the preventive measures.
Okay.
Get your screening done as much as possible. Weight loss can also help because you are reducing overall fat level. Basically, that's it.
So it means that the month of October, breast cancer awareness is not just for women. So men can also take advantage and go and then check their breasts.
Yes.
Men, please don't think that it's just your wife. You also need it. Go and then check your breasts.
Yeah.
We can do the screening for you in Royal House Chapel on Sunday after service.
Yes, Mommy. I think we can just take a comment.
This is a comment and just a question.
She says her name is Peculiar from Nigeria.
Wow.
Says, good evening, Mama Rita.
Good evening, Peculiar.
I love you and your program. God richly bless you.
Thank you.
And this may be our final comment. Says, Mommy, thank you so much for bringing these things to fore. I had a friend who was beautiful and black as charcoal. But I met her recently, and Mommy, she's now a white person.
Wow.
What is happening?
What is happening, my darling? What is happening? Well, our time is up. We might have to close the curtain today. Dr. Betty, thank you so much. I didn't know that when I was taking care of you, you were going to be a blessing to me. I honor your husband and tell my son-in-law that he owes me. In about 5 years, he's going to be big in this nation.
Amen.
So he should remember me. All I'll do is I'll call and I say, Doctor, please, your mom needs you now. Come and check my pressure. Tomorrow, I said tomorrow, next week. We are coming back same time next week. We are coming with a breast cancer surviving person. My darling, breast cancer is not killing. It's killing because we wait too long. The fact that a doctor tells you you have breast cancer or you have lumps in your breast doesn't mean that you are going into the grave. No. I know somebody who has lived over 25 years, had breast cancer, got her breast removed. Next week, Sunday. Next week, Wednesday. Why am I so much in a hurry for Sunday? Charlie, I can't wait for God on Sunday. Because of the convention. On Sunday, oh my God, my son, my beloved son, apostle in charge of America churches, has come all the way from grace to grace.
Wow.
To be a blessing to us on Friday and Sunday. Reverend Ima, if you are listening to me, I want you to know that you are my pride, you are my testimony, you are my joy. Maybe I have never told you, but today I want the world to hear. You were my member at, how do you call the ushering department? Christian Services. You were my member at Christian Services. You were so serviceable. You were down to earth. You were so humble. Tuesday, Friday, without anybody telling you anything, you can come all alone, sweep the auditorium, arrange chairs, stand and make sure that the chair, you measure with your eyes and make sure that it's measured so well. Little did you know that whilst you were doing it, there was a big man up there who was looking at you and said to you, this guy, one day I will bless him. My darling, if you are doing something for God today, if you are serving in the house of the Lord today, continue to do it, because your time and your day of elevation is coming. Your day of promotion is coming. Reverend Emma, I can't wait to hear you on Friday at 7 p.m. and then Sunday, 2 services. First service at 7 a.m. and second service, WMG service, at 10:30 a.m. But until then, make a date with me. Same time.
Mommy, sorry.
Oh, my
Before
God.
I sign you off, I just want us to acknowledge one of our own, Eugene, who is an editor here at Powerline TV. His birthday is coming Saturday.
Oh, wow.
23rd. Eugene is having.
Wow.
So, I want to wish Eugene a happy
Please,
birthday.
Eugene, happy birthday. Coming Saturday is your birthday.
Yeah.
When is Saturday's date?
23rd of October.
23rd of October.
Yeah.
Coming Wednesday is Reverend Derek's birthday.
Awesome.
Reverend
Awesome.
Derek is the apostle in charge of Area D, Accra.
Emmanuel
Reverend
Temple.
Derek, Emmanuel Temple, I'm wishing you a happy birthday now. If Wednesday I don't call you, I've called you already. So happy birthday in advance.
Amen.
And Eugene for Saturday, happy birthday. And my brother, our last born, Albert Atobra Owusu, is also celebrating his birthday on the 28th.
Wow.
On the 28th, that is Thursday, the day after Reverend Derek. Happy birthday, I wish you well. Perfect health, may you live long.
Amen.
May you be happy.
Amen.
I pray out of your life, all of you, sorrow, pain. And instead of sorrow and pain, I pray celebration.
Amen.
Please make a date with us, Convention of Saints, coming Friday and coming Sunday with Apostle-elect Emmanuel Agomeda. Have a good night. Stay safe. Live well. Eat well. Exercise. And stay out of the doctor's office. God bless you. And from my team in Powerline and Family Life with Mama RITA, we say God bless you and sleep well.
Powerline TV. Power to transform lives.